On today's episode of the Buzby Dog Podcast, we're going to look at an interesting phenomenon called compensatory injury in dogs and consider how to avoid it. And if you say, that doesn't sound like an interesting phenomenon to me, please stay tuned. Our story begins with my own personal experience that got me thinking about this topic. I am risk averse and I don't like pain, nor do I like falling through the air at 9.8 meters per second squared. So I really can't explain how I got talked into leaping off a 32-foot cliff at Slide Rock State Park in Arizona into a pool of murky water below. What I can explain is that as I hobbled back to the parking lot, I had a newfound appreciation of compensatory injury in dogs. Let me give you a little more backstory. Hours before this, I had been standing at the top of the cliff, yes, let's call it a cliff, watching this line of happy people jump off with confidence and glee. And from where I was standing, it didn't look very high. When my turn came, I walked up to the edge and I took one look and turned around to leave. But then I realized I had a new problem. To get to that jumping cliff, I had to climb up a series of rocks and then jump down this mini cliff. And I wasn't even sure it was possible to make it back down to the ground the terrestrial way. On top of that, one of my dear friends was with me. This was a really special trip, and she begged me to make the jump with her. And I'm embarrassed to say that I succumbed to peer pressure at 43 years old. When my head bobbed up out of the water, strangers all shouted, "Wasn't that great? Didn't you love it?" And my answer was a resounding no. It was terrifying, and on top of that, I had entered the water without any grace, and I had hit my right heel on a presumed rock on the bottom of the river, and I was in killer pain. I limped to the shore, and I proceeded to enjoy the rest of the day compliments of ibuprofen. However, my foot hurt even worse the next morning. I babied it for several days until I began to notice it less, thanks to the way the body prioritizes pain. And herein lies the veterinary topic of the day, one that I've seen a zillion times in my patients: compensatory injury in dogs. Okay, so we need to understand something else to be able to grasp this topic, and that is that pain is multi-synaptic. Okay, the prefix multi meaning many. This means there are many highways running to the brain, which all carry the sensation of pain. It's actually one of the ways that acupuncture works. We stimulate the body at acupuncture points, which shuts the gate, if you will, to other roads of pain from a sore joint or a sore back, a toothache, or whatever. So this phenomenon is why, by day 4, my heel pain was now the least of my problems, because now my left knee was killing me. So nerve endings in my knee were firing impulses to my brain, which made me less aware of my tender foot. And I don't normally have knee pain, but I'd created an overuse strain injury by compensating for my sore heel. I had been distributing my weight differently as I stood and walked, and as a result, I created a second problem. All right, so compensatory injury in dogs is a well-known phenomenon, and I will take the most obvious and common example, and that is a torn cruciate ligament. The cruciate ligament is called the ACL. It stands for anterior cruciate ligament. It's also called the CCL. That stands for cranial cruciate ligament. Those are synonyms. And it's reported that once a dog ruptures a cruciate ligament in one knee, again, sadly a common dog injury, that dog has about a 60% greater chance of doing the same thing in the other knee within about a year. It makes perfect sense. Think about all the extra work that the good knee has to do while the dog shifts weight off of the bad knee. Often, like my foot, the body pays a price for that shifting of weight, and we call that compensatory injury. It's an injury that occurred in the process of compensating for some other problem. So what's the moral of the story here? Of course, besides the obvious, don't jump off of cliffs. Number 1, dogs are tough. Limping means pain. Diagnose early. Okay, so if your dog is not fully bearing weight on a leg, that dog is painful. Even if he or she is not crying out or whining and still eating his dinner, trust me, if the dog's limping, it's almost always because it hurts to put the leg down. So my practice now is really focused on mobility in dogs. I do veterinary acupuncture, and I'm certified in animal chiropractic. And so by virtue of that line of work, I see mobility issues in dogs almost exclusively now in practice. And my clients get it. They understand that their dog is in pain because of facial expression, postural changes, the fact that the dog isn't doing something that he once was doing. He just won't jump on the couch anymore. So they get it. But over my veterinary career, I've heard many well-intentioned people say, well, I know he's like walking around on 3 legs, but I don't think he's in pain because he's not crying. Okay, that's a misnomer. I'm sure I'm preaching to the choir here. But if the dog's holding the leg up, as a general rule of thumb, it's because it hurts to put the leg down. Don't ignore this symptom, even if it's subtle. Early diagnosis and treatment are the best gifts you can give to your limping dog. Moral number 2, visit the vet, rest the dog. A dog that is noticeably and persistently limping needs to be seen by a veterinarian. I talked to a lady the other day at the grocery store, and she proceeds to describe her dog who is literally 3-legged lame. So the dog is only using 3 legs. This had gone on for about a week. And her question to me, I knew her casually from another situation, and so she knew I was a veterinarian, and so she stopped me, and her question to me, and it was earnest, and this lady is a wonderfully sweet woman, but her earnest question to me was, do you think the dog needs to see the vet? Okay, this is a dog that was 3-legged lame for more than a few hours. This had been going on. And I said, yes, please. The dog needs to see the vet. That is really important. Not only is the dog living in pain, but he's more likely to suffer a compensatory injury. So getting to that veterinarian sooner rather than later is really critical. And in the meantime, rest the dog. Okay, years ago, there was this subplot in veterinary medicine to consciously leave dogs in pain. Let's say dogs, this applied for post-operatively after a dog had been spayed, or for a dog that had an injury to a leg and maybe was recovering from an orthopedic surgery. So the thought was, well, let's leave them in pain so they won't overdo it. So the theory stated that hurting dogs would be more inclined to rest and stay off their feet. Thankfully, we've evolved. We now know scientifically that healing happens more rapidly when we mitigate pain. And this is a huge theme in veterinary medicine. There's a whole specialty in pain management. It's wonderful. But specific to the cruciate scenario, the ruptured cruciate ligament scenario that we discussed, by addressing the pain and inflammation in the leg, we're actually sparing the good leg. This decreases the stress on healthy joints and ligaments, and therefore decreases the risk of cruciate ligament rupture in the good knee. Now, exercise restriction, I've said rest the dog. Exercise restriction is probably going to be an important part of the recovery process, but it's now a part of home care management. It's now your homework, and it's not just achieved through the default status of a hurting dog. Please follow your veterinarian's orders explicitly, even though I know it's often difficult to rest an exuberant dog, but it's a vital component of the healing process. It's common sense, right? It's the same for us, but it's completely dependent on you. You are your dog's home nurse, and I promise you will never forgive yourself if your dog gets re-injured in recovery because you didn't follow instructions, and yes, we see that all the time. Moral number 3, doggy rehab is a good thing. Physical therapy, small animal rehabilitation is one of the fastest growing fields in veterinary medicine, and with good reason. It can make a world of difference. It is now scientifically proven to make a difference for the better in a dog's short-term and long-term success in so many areas, from weight management to post-op recovery after some sort of a surgery or injury. These dogs recover faster when they have rehab. We've known it to be true in people for a long time now, and now we know it to be true in dogs as well. And apparently pet insurance companies agree, because most pet insurance plans will now cover some form of rehabilitation services. Moral number 4, time and patience are virtues. Peel the onion. Okay, what do I mean by that? Well, compensatory injury in dogs can show up in a variety of ways. Muscles, tendons, ligaments, they all play a role in compensatory gait and posture. This could manifest in a variety of ways that aren't immediately obvious. So, inflammation or pain in a different leg or in the dog's back, for example, can manifest in the jaw. So part of a veterinarian's job is weeding out what issues are compensatory and getting down to what was the primary diagnosis. And we refer to this process as peeling the layers of an onion. Getting to that root issue, especially if it's been there for a long time, can take time. Remember, when it comes to compensatory injury in dogs, we don't have the luxury of patients who speak English and post their antics on social media to figure out how the injuries occurred. As long as your dog is moving in the right direction, be patient during your dog's recovery process. However, don't be shy about talking to your veterinarian about your questions or concerns at any point along the path. Rest assured, if you need to shed a few tears as we peel the onion, we fully understand.